So we will now hear a keynote from Erick Venant. Erick is a Tanzanian pharmacist and the founder and managing director of the Rollback Antimicrobial Resistance Initiative. Erick founded this NGO to reduce the resistance rates through the means of knowledge dissemination, research and behavioral change. He strongly believes that especially young people have the power to change, and he sees the lack of awareness about antibiotic resistance as one of its main drivers. And that's also why his lecture is titled "Knowledge is the Key."
All right, ladies and gentlemen, I'm very happy to join you all in this antibiotic resistance conference and also to celebrate 40 years of Buko. I would like to start by congratulating Buko for all the work they have been doing for the past 40 years. So congratulations on this anniversary. So this conference really reminds us about antimicrobial resistance, which is a silent pandemic. And actually, it really reminds us about the awareness approach in tackling antimicrobial resistance and in tackling different global health challenges. We are all aware that when microbes become resistant to medicine, the options for treating the diseases are being reduced. And as we all know that the global AMR action plan has different strategic objectives, and one of the strategic objectives is focusing on improving awareness and understanding of antimicrobial resistance through effective communication and education and training. So we really need to take the immediate steps in raising awareness about antimicrobial resistance and promote positive behavioral change using a awareness approach. I am always believing raising awareness is the simple and first step in tackling antimicrobial resistance. People must be aware and have the knowledge that will make them to use antimicrobials prudently and stop the behaviors that promote antimicrobial resistance. To be aware of the behaviors that accelerate the emergence and spread of antimicrobial resistance, and also we must all be aware that without knowledge, many people will be contributing to the development of antimicrobial resistance unknowingly. So let me share the story of one young girl who I recently met in the Dodoma region of Tanzania, known as Cecilia. So her story will remind us about the behaviors which accelerates this problem in our communities. So Cecilia used not to finish the entire course of antibiotic ciprofloxacin every time she suffered urinary tract infections. So every time she suffered urinary tract infections, she was just being able to buy the medicine from the drug outlets and just buy few tablets, and then when she used the few tablets, and when she felt better, she threw the rest of the tablets away. So this was her habit. Every time when she suffered UTI, she just use few tablets and threw the remain the rest away after feeling better. But later on, her condition became worse, and when she went to the hospital, then ciprofloxacin was not the drug of choice to treat her condition. And when they did the culture, they diagnosed that she developed resistant urinary tract infections, and as a result, now she was forced to go to other treatment options, which were expensive compared to ciprofloxacin. And actually, when I met her, she told me that after being told and being educated on the importance of finishing the entire course, she then adhered and completing the course, and then that was the end of her current infections, her current urinary tract infections. But this is just an example of people in our communities who are practicing different behaviors without knowing the consequences, without knowing the results, without knowing that there is the risk of developing resistant infections. So there are many people like Cecilia in our communities who are practicing different behaviors without knowing. And yet, as we all know, that this problem is being contributed by two parties, even more than two, but the general population and also the healthcare providers. So Cecilia also blamed the healthcare providers that if they were supposed to advise and educate her and the other patients every time they need a few tablets. So this is just an example of the behaviors which are taking place in the community due to lack of knowledge regarding antimicrobial use and antimicrobial resistance. So imagine how many infections would be preventable by just people being aware about the importance of preventive measures like hand hygiene. We have all learned this during this era of COVID-19, that simple measures like hand hygiene are very important in preventing the spread of infections, including the resistant infections. And we all know that every infection that is prevented does not need treatment, and this reduces the misuse of antimicrobials and notably antibiotics. So we should be able to conduct antimicrobial resistance awareness raising campaigns targeting different groups in our communities, from the general population to the healthcare providers and also to the policy makers. We must also admit that changing people's behaviors is not easy, and the older a person is, the more they are set in their ways. So for me, I really believe that engaging the youth, engaging the pupil, the students, the school children, educating them about antimicrobial resistance, I think it's one of the good approach to contain these antimicrobial resistance, because these are in their formative years, and this is a right time to impart knowledge and best practices that will guide their behaviors for the rest of their lives. So we must target different groups in making sure that we raise the awareness and we deliver the knowledge about antimicrobial resistance. Unfortunately, information on knowledge, attitudes, and the practices on antimicrobial use and antimicrobial resistance is still insufficient. So we should also keep conducting research that increases knowledge and that will support the evidence-based actions on antimicrobial resistance. As I've said before, one of the objectives of the Global Action Plan on antimicrobial resistance is to improve awareness and understanding of antimicrobial use and resistance. But this task really need the involvement of many stakeholders and many sectors. That's why we really encourage a 1S approach as a key tool in containing antimicrobial resistance. So we still need more efforts more effort should be taken to contain and slow down the development of antimicrobial resistance. Because I'm focusing on knowledge and awareness, let's keep using different opportunities to deliver antimicrobial resistance knowledge. This includes clinical meetings, professional association meetings, community gatherings, and also recognize the global and national health days, but also the use of mass medias, for example, local radios, social medias, and outreaches to colleges and to secondary schools and other schools. But also, what I would also remind everyone that the communication message must also be customized according to the audience characteristics, according to the local community. So awareness raising on antimicrobial resistance should also consider the local needs. It's very nice that we are having the World Antimicrobial Awareness Week taking place every year. And currently the tripartite, the WHO, FAO, and OIE has fixed the date for World Antimicrobial Awareness Week, which will be taking place every 18th in November every year. The date has been fixed starting from last year. So this is a good opportunity to raise the voice, to raise the awareness, and encourage the best practices global regarding the antimicrobial resistance. But I think it would be very important, and I think everyone would be happy to see that the momentum on raising awareness is being kept even after the World Antimicrobial Awareness Week. So we keep the same effort, we keep the same momentum on raising awareness, on bringing the attention about antimicrobial resistance, even after marking the World Antimicrobial Awareness Week. So let me finish by again reminding that 1S approach is vital in addressing antimicrobial resistance, and simple measures like awareness raising are essential in tackling antimicrobial resistance. Let's start with the small interventions in our communities, and that's how we'll be spreading the knowledge and spreading the information, which is a key step in containing antimicrobial resistance. So again, congratulations, Buko, for marking this anniversary, and thank you very much for listening me. Asante sana, vielen Dank. Thank you very much.
Thank you very much, Eric, for giving this experience and insight into the Tanzanian situation. So, Jörg, are there any questions in the chat for Eric?
Yes, there is a question, and I'll try to let Christopher ask himself what he wants to comment. Christopher?
No, thank you for giving me the floor. Congratulations for this excellent presentations of Gopal, Andy, and Eric. They were very rich, and that was the reason why it was me who asked for the presentations, because you want to deepen your learning process and your knowledge also following the links. For me, in the presentation of Andy and Eric, it was very important that antibiotic resistance is an issue of knowledge, skills of the prescribers. And if you look at medicines being and antibiotics also being sold in the streets and elsewhere. That makes it even worse. The skills, the knowledge, and the subscribers reminds us that you need a health system to deliver antibiotic therapy. And health system strengthening, therefore, it's not only a question of medicines, of the quality of medicines, of the antibiotics. It's a question of the health system. And there, it was Gopal who reminded us that with $75 per capita, the total health expenditure, for example, in India is very low. And if 30% is in the public system, it's also very extremely low. We need a health system to deliver medicines, to apply vaccines, to have cold chains, to have the staff to do this and all this. So at the end of the day, to what it boils down, in my view, is the financing of health systems. I am working in a country which is Sudan, where the total tax revenue is 6% of GDP, and this little cake only very little has been to the social sectors and health under the previous regime, but that was more concerned about security and repression. So what my comment on all this is that we are talking about health systems who are able to assure a rational antibiotic therapy. They need to be financed. We need to increase public financing. And we have to move away from a pro-poor focus to a pro-equity focus, because unless we tax the richest 1% and the multinationals, we will never have the resources to strengthen our health systems and to avoid antibiotic resistance. Thank you. That was my comment.
Yeah, thank you very much. There's another question by Hedwig. Will you pose, probably it's primarily to Erick, but maybe you can tell yourself.
So I think you can hear me now.
Yes.
Yes, thank you very much for all the presentations. That was in fact a question to Erick. You said for reaching your target groups you use social media, and I'm interested in which tools you exactly use, and if you did an evaluation, if it's the right thing to reach the people.
Yeah, maybe Erick can answer directly. Erick, you are unmuted. You should be able to talk if the connection is still working. Okay. That seems not to be the case. So we have to get an answer later. I'll write.